Let's see the definition of dysentery. Dysentery is characterized by diarrhea with increased blood and mucus, often associated with fever, abdominal pain, and tenesmus. What is tenesmus? Tenesmus is the feeling of constant need to pass stools despite an empty colon. So, dysentery is characterized by diarrhea. What is diarrhea? Diarrhea is defined as the passage of three or more loose or liquid stools per day in excess than usual habit for the person. So, diarrhea is defined as the passage of three or more loose or liquid stools per day. And if these liquid or loose stool is accompanied with blood and mucus, it is known as dysentery. Dysentery is often associated with fever, abdominal pain and tenesmus. ठीक है, tenesmus मतलब even if the colon is empty, the person will have constant urge to pass stool. So, dysentery is characterized by diarrhea with increased blood and mucus, often associated with fever, abdominal pain, tenesmus. Dysentery is caused by either bacteria or it can even be caused by parasites. So, the bacteria causing dysentery are Shigella, the most common cause of bacillary dysentery. Other causes of bacillary dysentery are Campylobacter jejuni, Enterohemorrhagic E. coli, Enteroinvasive E. coli, and Vibrio parahemolyticus. So these are the bacteria causing dysentery. The most common Shigella, then Campylobacter jejuni, Enterohemorrhagic E. coli, Enteroinvasive E. coli, and then Vibrio parahemolyticus. And the parasites causing dysentery are the most common is Entamoeba histolytica, then Ballantidium coli, Trichuris trichiura, and then two species of Cystosoma, that is Cystosoma mansoni and Cystosoma japonicum. So these are the parasites causing dysentery. The most common being Entamoeba histolytica. Others are Ballantidium coli, Trichuris trichiura, Cystosoma mansoni, and Cystosoma japonicum. The bacteria Shigella and enteroinvasive E. coli. These are the major causes of dysentery. Shigella and enteroinvasive E. coli. Let's see the differences in stool characters between amoebic and bacillary dysentery. In case of amoebic dysentery, the ulcer is deep, margin is ragged and undermined, intervening mucosa is normal, and the cellular response is mononuclear. The pathology for amoebic dysentery is that it causes deep ulcers, the margin is ragged and undermined, the intervening mucosa is normal, the cellular response is mononuclear. In case of bacillary dysentery, the ulcer is shallow, the margin is uniform, the intervening mucosa is inflamed, and the cellular response is polymorphonuclear. Okay, so this is the difference in the pathology of amoebic dysentery and bacillary dysentery. The ulcer is deep, ragged, and the margin is ragged and undermined. The intervening mucosa will be normal. The cellular response is mononuclear in case of amoebic dysentery. In case of bacillary dysentery, the ulcer is shallow with uniform margin, and the intervening mucosa will be inflamed. The mucosa will be inflamed, and the cellular response is polymorphonuclear. Let's see the stool macroscopic features. In case of amoebic dysentery, the number of motion is 6 to 10 per day. The amount is copious amount. Color will be dark red Odor is offensive, reaction is acidic, and the consistency will be that it's not adherent to the container. In case of amoebic dysentery, number of motion 6 to 10 per day. Amount, copious amount of stool. The color will be dark red. The odor will be offensive. The reaction will be acidic. And the stool, it will not be adherent to the container. In case of bacillary dysentery, the number of motion will be greater than per 10 day. Then the amount will be in small quantity, the stool will be in small quantity, color will be bright red, it will be odorless, the reaction will be alkaline, and it will be adherent to the container. Okay. So this is the difference in macroscopic feature of stool. In case of amoebic dysentery, number of motion 6 to 10 times per day, amount copious amount, color dark red, odor offensive, reaction acidic, and the stool will not be adherent to the container. In case of bacillary dysentery, number of motions greater than 10 per day, in small quantity, color bright red, it will be odorless, reaction alkaline, and it will be adherent to the container. Now let's see the stool microscopic features. Now after macroscopic features, we will see the difference in microscopic feature of the stool. In case of amoebic dysentery, red blood cells will be in clumps. Pus cells will be few. Macrophages will be few. Eosinophils will be present. Charcot-laden crystals present. Pycnotic body present. Pycnotic body is the nuclear remains of tissue and leukocytes. Then the organism detected will be Entamoeba histolytica, cyst, and trophozoite. So in case of amoebic dysentery, in stool, RBC will be in clumps, pus cells will be few, macrophages will be few, eosinophils, charcot-laden crystals, pycnotic body will be present. Eosinophil will be present, charcot-laden crystals will be present, and also pycnotic body will be present. And we will detect Entamoeba histolytica, cyst, and trophozoite in the stool. Now in case of bacillary dysentery, the RBC will be discrete or in Rolex. Pus cells and macrophages will be numerous. Eosinophils will be absent or rare, and charcot-laden crystal will be absent. Pycnotic body will be absent, and the organism detected will be a bacteria, example Shigella. So this is the difference between amoebic dysentery and bacillary dysentery. In case of amoebic dysentery, ulcer will be deep, margin ragged and undermined, intervening mucosa normal, cellular response mononuclear, number of motions 6 to 10 per day, amount of stool copious amount, dark red color, offensive odor, acidic, and it will not be adherent to the container. RBC will be in clumps, pus cells and macrophages few, eosinophil present, charcot-laden crystal present, pycnotic body present. The organism detected will be Entamoeba histolytica, cyst, or trophozoite. In case of bacillary dysentery, shallow ulcer, uniform margin, intervening mucosa inflamed, cellular response polymorphonuclear, number of motions greater than 10 per day, amount of stool small amount, color of stool bright red, odorless stool, alkaline stool which is adherent to the container. Then the microscopic features, RBC will be discrete or in Rolex. Macrophages and pus cells numerous. Eosinophil rare or absent. Charcot-laden crystals absent. Pycnotic body absent. Organism detected will be bacteria. Example Shigella.